Hi, this is Penny, and we're back with your antipsychotic or medication template, Risperidone, and we're going to go over some of that. Risperidone is a second generation med. It treats both positive and negative symptoms. Underneath that generation, there's olanzapine, and there's clozapine, quetiapine, and clozapine is the one that has something special about it in the fact that you can get blood dyscrasias very easy with it. And why is that so important? Because they will actually send them to the lab every week. They have to get their white blood cell count drawn, and they have to take that to get their medication from the pharmacy each week. If they don't do their lab, they don't get their med, and they slowly titrate them up on it, and they slowly titrate them off of that, just because of that complication that can happen. So there's a lower EPS or extrapyramidal symptom risk for a second generation compared to a first. That's a big deal. And then your second generation, you're going to want to know your side effects, because they are different than mood stabilizers or antidepressants, etc. And so I'm going to go over about 4 areas that are specific to antipsychotics, and they're not in the other ones. They're different. Each one of them has a hallmark or hallmarks that go with it. So, okay, some common things that happen with an antipsychotic is they have drowsiness and dizziness and hypotension and anticholinergic symptoms like dry mouth. Okay, these are just gonna happen. They happen with everybody. So those are common. So some of the other things that are kind of more important would be extrapyramidal symptoms happen with antipsychotics, and that would include dystonia or tardive dyskinesia, which is more emergent, and they change meds lots of times with that. There's Parkinson's-like symptoms, akathisia, where the feet just feel really like they just need to move. It's very agitating to a patient. Very high rate of suicide from patients just not even being able to handle that movement. So they have benztropine that they can give to counteract that. If it doesn't help, then they might have to change meds. But the extrapyramidal symptoms, you're going to want to, like if you're in an acute unit, every month they're going to have a sheet that they have you go over and assess their extrapyramidal symptoms and see if they're getting worse or if they're getting better. And they can get worse right away, or after years they could get worse. So that is something that they would do. So there's, you just instruct the patient to report if they start having symptoms like that, if they're not inpatient. So then the other thing that is really important that you understand with second generation antipsychotics, there is definitely weight gain. They can have a new onset or worsening of diabetes type 1. So it's really important with these patients that you teach them to monitor their blood glucose. If they're already diabetic, they need to be taught to exercise, eat correctly with low fat, low sugar, then report any of the polydipsia, polyuria, those type of symptoms. So with this, what are some of the things you'll do as a baseline to begin with? Okay, so you're going to make sure and get them on the scale, see what their weight is. You're going to get a lipid panel because their cholesterol will go up, because it's almost inclusive of like metabolic syndrome that they will end up with, which heads towards diabetes for sure. That's a big, big complication of this med in a lot of people. So you're going to want to get a blood glucose level. You're going to want to get a blood pressure level. that's some of the things that's one of the really important things you understand. Now, in mood stabilizers, yes, they can gain weight. With antidepressants, they can gain weight, but you won't see them. It's a hallmark for antipsychotics because they can become diabetic very easily and usually will in time become diabetic. Whereas with a mood stabilizer, they're going to gain weight. They're just going to gain weight. Okay, so it's not a hallmark for bipolar. Something to consider, but not a hallmark. So that would be pretty much your antipsychotic med